when the presentation on social networks was as it started, I realized that there is a direct relationship between the social networks and the way they work and the way that they could possibly be interrupted or restructured, and the way that racism operates. And I was thinking that, Kayla, if you had substituted skin color or ethnic identity for obesity in your presentation, you could have told the same type of story, the homophily and propinquity. So I just wonder if you could comment on that. And then perhaps, Chandra, you can comment as well how racism as a system involves networks within and across different ethnic groups. But Kayla, let's hear from you first.
Sure, thanks for the question. So yeah, when we study the evolution and emergence of these social networks, often we look at a rich set of variables that might predict social ties forming and maintaining and people being excluded and discriminated against in networks. And often we find that there's multiple features at play. So not only are individuals marginalized and socially rejected based on obesity status, but we often find that over and above that, that social selection and social mixing is based on race and ethnicity, on socioeconomic status, on gender, if we're looking at children. And so looking at how all of these different factors are correlated and how inequities and health risks are concentrated among certain populations, all of these factors contribute to the social clustering and allocation of resources and segregation of certain populations and broader social networks and exposures to different types of social environments.
Thank you. Chandra?
I was noticing the same point when you were giving your presentation. And it is very interesting. I think that critical race theorists would say that important points to consider would be what are the differences and similarities between stigmatization tied to racialization and stigmatization tied to obesity, and see there are differences. Certainly there are intersections. And I'm also thinking about some work that I was involved with Natalie Crawford, not around obesity, but network analysis around various forms of discrimination among substance users, and finding a very similar pattern where essentially those who had experienced discrimination were more likely to form into groups of their own, to form social network ties, so that it essentially reinforced potential, in our case, HIV risk among people who had experienced discrimination. But there were also interesting racial infusions of this pattern, such that the findings differ depending on the levels of residential segregation in which those networks existed. So I think it really highlights the opportunity to do a lot more work in this area.
Yeah, definitely. Chandra, this next question is for you, and it to give you a chance to talk a little bit more about big data. The example that's in the news these days has to do with algorithms, facial recognition algorithms, and how they're interpreted. There's some other examples that I've heard in terms of even scheduling for healthcare appointments. People think that certain characteristics are associated with not showing up for the appointment, and they bake those into an algorithm, then those people might have to wait longer time for an appointment because of their characteristics. So can you comment on the big data issue a little bit more?
We do not yet fully understand what kinds of issues will emerge with big data in general, much less around what's going to happen or what might happen with racial and with racism related dimensions of it. part of it is that the big check that would be available to it would be partnerships with community, and making sure that there's transparency and access to the data, not only so that people understand what's there after the data are collected, but also to drive and monitor exactly what kind of data are created and constructed. So as a simple example, surveillance, policing-related surveillance tools are generally developed and directed to point in a particular direction, that is, towards expected crime or towards existing or prevalent crime. However, different types of tools would be needed to turn that gaze around and look at what causes crime or even who's doing the surveilling. So those are the kinds of questions that racial justice advocates are asking around big data, in addition to who owns the data.
Thank you. I'm just doing a time check. I think we only have time for one more comment from each of you. So Kayla, I'll just say that it sounds like, and then we'll go to the audience Q&A, that for both of you, it sounds like we're working against human nature to try to help human beings. And that might be in terms of the way that you're analyzing data, both systems on both sides, racism as a system and the social networks as systems. So if you want to make any comments as we transition to the audience Q&A, Kayla, you go first.
So I think I try to see that point as an opportunities for intervention. So by understanding some of these phenomena and the way that systems operate, we're identifying new intervention points. So in the social networks literature, there's often been a focus on an idea of contagion and things spreading through networks, and that we really need to stop that or intervene on that one point. But as we understand these social dynamics and how networks emerge, it highlights different points and, for example, the role of weight-based stigma or discrimination in structuring networks in the first place. And it really emphasizes that there's different intervention points in these feedback loops that could be addressed as part of obesity solutions.
Thanks. Chandra?
I'm really struck by apparent parallels between system science and critical race theory in terms of helping to study something very systematically using all kinds of tools and approaches in order to make these sort of underlying complex relationships apparent. And that seems like the first step in order to intervene. And I think that there, at least right now, there's no better resource than those that system science provides, no set of resources that it provides in order to begin to do that. So I'm actually very optimistic.
Thank you. So to the audience, you have a chance to ask questions. If you put them in the chat, if you want to direct them to a particular speaker, you can indicate that. So I don't see any questions yet. I can we'll give you a little time to come in. Okay, is this? Okay, I believe this is a question. This question is about breastfeeding. I'm not sure it's that these presenters will have anything to comment on, but I will ask. I'm wondering if these speakers or others today plan to address breastfeeding as a way to prevent obesity and how race and racism play into interventions that have been implemented and found to be effective. Okay, that is an important subject. So who wants to comment? If it's race and racism, it might be you, Chandra, who would be answering that related to breastfeeding.
That's a very complex question. And I would point to the work that various groups around the country are doing around this. My colleague Ida Amani at Charles R. Drew University are trying to address these questions around birth and pregnancy. But I still don't know about the breastfeeding part, so I'm going to decline to answer outside of my area of expertise.
Yeah. Well, Kayla, you might. I know that breastfeeding support groups and so forth are a part of some of the interventions that are used to try to encourage and really enable breastfeeding. Do you have any knowledge about this?
Not a lot. I guess my experience in the interventions that we deliver that do focus on breastfeeding is just one component of obesity prevention for infants in the first few years of life. We've really worked with promotoras and other community-based partners to deliver these interventions within the family system and really privileging their insight and their reading of the family's beliefs about breastfeeding, other types of cultural factors that would play into these choices. And so we're really just starting to study how different sources of information and influences on breastfeeding within social networks are influencing some of these behaviors. So this is a new area for me. Mm-hmm.
Thank you. And just to comment, because I've looked into breastfeeding, somewhat ethnic differences and the disparity in breastfeeding, lower rates of especially exclusive and long duration breastfeeding has been tracking lower for Black women for decades. And so it is definitely something to look, what systems are working against increasing those rates. So thank you. Can we have a couple of questions here? To either or both, to what degree is proactively countering homophily, behavioral, demographic, and other types of homophily in networks desirable in addressing obesity as well as other health outcomes? And then how can critical race theory and or social network analysis help us in understanding how to intervene in this way? So it's two questions, but to start, since you brought up homophily, Kayla, why don't you start with that?
Sure. So I guess countering homophily is an interesting intervention strategy because we as humans have evolved to connect with people that we can communicate with and relate to. And so we often seek out people that speak the same language. We feel a connection when people have some sort of shared background that we can relate to. And so there's this process that we have to think about how we are intervening on that and how to do that in a way that would support health. The work that we've done, I think, really emphasizes that stigma is really a key force resulting in a lot of the homophily that we observe in health networks, such that people with certain characteristics and certain health attributes are actively excluded from certain relationships. And that pushes or reinforces this tendency for individuals not to have the opportunity to form social ties to others. And so we see this a lot in the social networks of children, where a lot of the homophily and similarity on weight status, but also other attributes, really stems from stigma and discrimination and the exclusion of certain social ties. And so my thinking on this is that it will be interventions that seek to address stigma and discrimination that will help reduce this marginalization of certain individuals and segregation of individuals into segments of a social network that are characterized as being very homophilous or similar.
Thank you. And can critical race theory help to combat this?
I would echo what Kayla said, that from a more critical race analysis, that to the extent the question is asking, can we leave those structures of stigmatization and inequality in place and simply move individuals across those structures or particular groups? Critical race analysis would say that the problem we should target is the inequality, the stigmatization, those things. So.
Thank you. Another question is, how should we measure race as a social construct in research settings? Do you have a comment on that?
There are many, many different ways to do so. However, one of the first steps is thinking about what exactly is it about the ways that racism, broadly speaking, is acting on a group or individuals that is of interest to the project. So it is important to anchor it to a specific project in order to be able to see, is the way that racism is operating tied to, for instance, the experience people have when they're walking down the street and how others perceive them. If so, despite the fact that we often say self-reported race is the ideal gold standard measure of race, in that circumstance, perceived race, how other people perceive one, will provide a better measure of the social experience of racism. So that's one example.
Yeah, that's interesting. I know Tamara Jones had done some work on that quite a while ago, asking people how they could pass, basically, if they were lighter skinned, and that was determining some of their experiences, how they were perceived. Here's another very challenging question. I want to make sure we get to talk about this one. This is from Eric Heckler to everyone, and then to Dr. Ford. I'm thinking of Dr. Dorothy Roberts' work on highlighting a fundamental bias in biomedical research, with capitals, bio and capitals. In brief, even with clear evidence and recognition of socially constructed constructs like race, we continue to fall into the trap of essentialism, meaning biology is causal, social constructs are not. This can even be heard in the comment that I made, or in Dr. Kamunika's comment, we are fighting our nature. What are your thoughts about how we may be able to impact systemic bias towards thinking that causes must be biological or part and one's nature over socially constructed? And that's the interest. I'm glad to have a chance to talk about this, because I was not necessarily thinking about biology when I said human nature. I'm thinking about ethnocentrism and pecking orders and things of that nature. But John, you go ahead.
That's a great question. Obviously, bigger than what any one person can respond to fully in this amount of time. But what I would say is we have not invested the resources in studying our own subjectivities that we bring to the work. And so it should be no surprise to us that we do not see them very easily. We fill in the blanks in our results all the time in the literature with what I would call presumably our a priori assumptions. We've done a little work in this area. And so I would say that part of it is to begin to study our own approaches in order to reveal empirically the extent to which we are or are not actually reifying biologically deterministic understandings of race, for instance. And this is what the public health critical race praxis version of critical race theory is intended to facilitate. That is, to be able to apply these principles and ideas and even methods, as legal critical race theorists would call them, to the kinds of research approaches that people in public health and other health sciences use.
Thank you. Yeah, definitely more than any one person can answer. I think this is a question: what specific methods can organizations like the Roundtable use to address structural racism when attempting to impact systems? So this, I think both of you could answer. We'll start with Kayla. Why don't you comment, maybe from your expertise, things that the Roundtable could do?
Oh, well, I feel like this question falls much more squarely in Dr. Ford's expertise, but I guess from my perspective and using methods like social network analysis or systems approaches can help provide a lot of new insight beyond the perspective of individual experiences, and highlight how phenomena like structural racism actually play out and structure people's experience and exposures and health risks, and that these methods can help us advance this science and advance understanding of our intervention strategies. But I'll turn it over to Dr. Ford. Yeah.
Okay.
I would start by saying, as simple as this sounds, it's important to name it. That is a challenge that researchers who focus on racism have repeatedly faced over the years. And so I have to say I'm very delighted and pleased that this roundtable invited a conversation on structural racism. I think that in and of itself is such a crucial step. So I think education within the roundtable and guidance for the field in terms of the work. So how can we both address, the ways in which our understandings of structural racism and the ways that structural racism is working amongst us, the researchers, as well as how it is working out there sort of in society, looking at the relationships that we're studying. I would focus on both components of that.
Thank you. So we're coming to the end of this session. Just one point, if you have a quick comment, each of you, on this. This process of naming racism and understanding perhaps counterproductive characteristics of social networks involves two types of people on both sides of the coin. And we haven't talked about how engaging in this process affects people who would be considered to be on the power side, having power and driving the systems of, benefiting from the systems of structural racism, or benefiting from a homophily, a type of behavior that is excluding others. And so if you could just comment on what you think is the next step for the people who would be the, have to give up or change their behavior in order to get to the next step. You can go first, Chandra.
An important thing to remember is that race is a relational construct. That is, it really has meaning when comparing, for instance, Black relative to white, and looking at that connector between the different communities, because that is the place where we understand, that's the intervention point, how one group gains from another group, one unearned set of privileges, and are tied to an unearned set of disadvantages. Again, I believe that a big part of it is actually conducting research. And this was one of the questions in my slide. How do we not treat the disadvantage as an attribute of the minority population, but rather as one part of a bigger picture where the gains of the dominant group are actually not being captured. So I believe that we actually need to start measuring that as something that's not currently being captured in a lot of studies.
Yeah. Thank you. Michaela, you have the last word, and then we'll move into the next session.
Thank you. So I think the point I would emphasize is one that Dr. Ford and I both made towards the end of our slides around who is conducting this research, who is collecting the data, and how we're interpreting it. And in system science, there's a focus on having multi-sectoral and multidisciplinary teams, and teams that involve and equally privilege the views of community partners and other stakeholders. And so I think that will be a key to understanding the data that we're collecting and privileging, and how we're analyzing it and interpreting it, so that we do this in a way that sheds light on a lot of these phenomena and gives us opportunities to address them.
So thank you. And thank to both of the speakers this morning for really setting a tone of deep reflection and understanding to get to the next stage. And I hope the roundtable members and the larger audience will benefit from this. And so I will turn it back over to Nico, I think, to introduce the next session.